Hygiene. Nurses use the nursing process to help guide their method of care. The nursing process is a set of sequential steps, and it is different for a registered nurse and a practical nurse. There are 5 steps used by the registered nurse, and they are assessment, analysis, planning, implementation, and evaluation. There are 4 steps used by the practical nurse, and these are data collection, planning, implementation, and evaluation. For the nurse assesses the patient's skin because the skin has 2 roles to help protect the patient against pathogens. The first is the skin serves as a physical barrier to protect internal parts of the body. The second is that the skin contains Langerhans cells. The role of these cells is to sense and kill pathogens that are found on the skin and that are trying to enter the body. Hygiene is vital to maintain the skin integrity. Hygiene are actions that are taken and health practices that an individual engages in to decrease the spread or the transmission of pathogens, and this assists in decreasing the risks of illness. The skin integrity must not be compromised. However, when the skin integrity is compromised, oftentimes the skin will become irritated and reddened and inflamed, or the skin barrier is open from a cut or a tear. Either of these can allow bacteria to enter the individual's body. Individuals that frequently experience incontinence, either urine or feces, have an increased risk of skin damage. Effective hand washing is necessary to prevent infection as well as hospital-acquired infection, because evidence has determined that hand hygiene decreases the infection rates. Hospital-acquired infections develop when an individual is in the hospital or another healthcare facility, and the infection was not present when the individual was admitted to the facility. Hand hygiene can be soap and water or a 60% alcohol solution. For healthcare individuals, we use soap and water when our hands are visibly soiled, after we provide care to an individual that potentially or has infectious diarrhea, or after we are exposed to bacteria-producing cells like Clostridium difficile or C. diff. Healthcare providers may use an alcohol-based hand sanitizer before touching an individual, before completing a sterile technique such as inserting an intravenous catheter or touching an intravenous device, after contact with soiled areas, and before moving to a clean area on the same individual, after touching an object in the client's environment or the client, after coming in contact with any body fluids, and after the removal of gloves. The nurse needs to educate the client about the importance of hand washing as a way to prevent infection. Health promotion is facilitating an individual's control over and their ability to improve their overall general health. The focus of health promotion is to create awareness of health problems, encourage positive behavior changes, and increased utilization of healthcare services. There are some barriers to health promotion. Client privacy. When the client's body is exposed, for example, the nurse may be providing personal care, the individual may feel that they have lost control over this environment and this situation. During this time, the client's perception of being cared for is compromised. For developmental considerations, newborns and infants only need bathed 3 times per week, and this should be sufficient. Bathing more frequently may dry out the infant's skin. School-age children and teenagers go through hormonal changes that may cause changes of the skin due to production of oil from the oil glands and an increase in sweating. Good hygiene habits include daily bathing and washing their hair minimally every other day to prevent odors and a buildup of oils. An older adult may show some resistance with showering or bathing, and this may be due to their illness or disease process, but there are other considerations. The person may have pain with mobility. The person may fear water or the sound of water. They may have a fear of falling. They may also fear the water temperature. It may be too hot or too cold. The individual may have difficulty getting in or out of the tub or the shower, and they may lack energy to bathe or to shower. There are also various physiological considerations when thinking about various disabilities. When an individual has a stroke, they can suffer from motor loss, weakness, or paralysis on one side of the body that is due to damage to various brain cells. If an individual has a spinal cord injury, there may be adaptations for bathing and showering that are necessary to maintain the individual's safety and avoid further injury. Spinal cord injuries may cause a loss of ability to feel temperature, and this will require adjustments to the water temperature to prevent any scalding or burns. For visual acuity, there are various causes: cataracts, ocular disease, diabetes mellitus, stroke, congenital visual impairments, accidents, age-related degeneration. Bariatric challenges also may be considered a disability. An individual has an increased body weight or a body mass index. This increase in body mass index correlates with a higher need for assistance with personal care needs because of the individual's increased comorbidities and decreased functional ability. Dementia is also a consideration. The condition will progressively worsen with time and eventually will lead to an inability for the individual to be independent to perform their own activities of daily living, considering bathing, dressing, or grooming. An individual that has an amputation may also have difficulty with activities of daily living. For hygiene care, when a nurse or a nurse's assistant assists in performing the activities of daily living, The nurse will evaluate the ability of the individual to perform their own activities of daily living, and during this time will consider the healthcare setting and the individual's needs. Clients should complete as much of their own activities of daily living as possible. Bathing is cleansing the skin, or it is used for therapeutic benefits. Bathing will help remove dirt, sweat, pathogens, dead skin, and enhance blood circulation. The bathing method will depend upon the individual's needs and their preferences and religious beliefs. Linen changes should be accomplished after a bath and when the individual is out of bed. However, sometimes the individuals may be bedbound and a linen change is required. Before performing the procedure, the nurse should determine if any as-needed pain medications are required before turning the patient from side to side to complete the linen change. Hair and scalp care. The hair is brushed as often as needed to avoid tangling and spread of oil to the hair shaft. Hair does not need washed on a daily basis. Every second or third day will be adequate for an older adult. For eyes and ears, eye care is performed daily. Ear care is performed with a washcloth covered finger. There should be no cotton tip swabs or sharp pointed items used because it can cause an injury of the ear canal or the eardrum. Feet should be inspected daily and cleansed using soap and water, then completely dried, paying attention to the areas between the toes to ensure that the individual does not get any fungal infection. Nails are a mode of transmission for germs. Germs are present in high concentrations under the nails. Longer nail length has been shown to conceal a greater number of germs. Perineal care is cleansing the perineum, and this may be performed during a bed bath, a tub bath, or shower, or as needed if the individual is incontinent of urine or stool. Oral hygiene is keeping the mouth and teeth clean by brushing and flossing and using a fluoride mouthwash. Teeth should be brushed twice daily, approximately 2 times during each brushing.